just like Sahar mentioned, we are CovidVacNet, and we are a global network analysis of the COVID-19 vaccine distribution to predict breakthrough cases using network science and machine learning. Okay, so here's just a quick overview of the table of contents or what we're going over today. First is going to be the introduction, where we're going to talk about the background of our project, the justification for why we're doing our study, and the abstract. The second is the progress that we've made so far, the methods that we've used, and a good look at the code that we've used. And then we have future work, which means the remaining work that we have to do and where we see our project going in the next couple of months. And finally, we have a closing, which is just a wrap up and a Q&A. So starting with the introduction, which is a background on pandemic analysis and our abstract. Right off the bat, we'd just like to introduce you to a couple of terms that we'll be throwing around throughout our colloquium today. The first is vaccine candidate, which is a vaccine that's developed by a private or public organization that has passed clinical trials, but has not been approved by residing drug and food organizations. And this is usually deployed simply due to the urgency of a situation, which is what we see a lot during the COVID-19 pandemic, where we can't exactly wait for like the FDA to approve vaccines. We need to deploy them in order to keep people safe. And then finally, we also have breakthrough infections, which is a special case in which a fully vaccinated individual or an individual that is at least up to date on their vaccinations can contract a virus. And this happens not often, but it does happen with COVID-19. To the right are a couple known vaccine manufacturers and providers that we will also be throwing around pretty casually in our presentation today. Most of them are pretty familiar to you all, but we just like to rehash them. It's AstraZeneca, Novavax, Pfizer, Sanofi, Johnson & Johnson, Moderna, and Sinovac. So talking about the background of our project, as we all know, the ongoing COVID-19 global pandemic was caused by severe acute respiratory syndrome coronavirus 2. And multiple vaccines have been developed and underwent clinical trials to prove efficiency, like, for example, the one produced by Pfizer and biotech. But while vaccines are currently being developed, no vaccine is always 100% effective. And that's where we see what we mentioned before, breakthrough infections occurring, in which you have this individual who's fully updated on their vaccines, but they still contract the virus. Even though it is often infrequent, we still want to prevent that from happening. Furthermore, with the appearance of new variants such as the Delta variant or the Omicron variant, variants that have dominated the news for almost like the last couple of months, it is now being questioned whether vaccinated individuals who are subject to a breakthrough can also contract these variants in another form of breakthrough. And it is for all of these questions that we decided to launch our study. And specifically going into, specifically going into an introduction of our study, we have to understand that COVID-19 spreads through social networks, as people who contract it are more likely to pass on to their connections, like your family, your friends, employers, coworkers, etc. Which means that COVID-19 can be modeled just like almost any other virus, following a typical epidemiological spread. And for our network, we choose to model it off of the Barabási-Albert model. This is a pretty famous model if you've ever learned about network science, because it's used to generate very large scale-free networks. Scale-free essentially means there is no upper end to the network, which is perfect for a human environment in which there is no upper end to the humans like in that environment. Beyond that, by using most social networks also contain a few hubs or nodes with higher degree in comparison to other nodes. So some network models aren't able to explain the existence of these high degree nodes because they simply model an interaction on a one-to-one basis. But the Barabási-Albert model is pretty good because it takes into account geospatial data, which explains the existence of high degree nodes and why you can have so many infections, for example, in the United States, but not exactly in like a country like Taiwan. By using the Barabási-Albert model, we can realistically capture these high degree nodes or locations of the spread for COVID-19, which is, again, especially helpful in modeling specific locations of interest within high degree cases of risks. So the goals of our project are pretty simple. First, we want to map the vaccination candidate connectome using network analysis with the Barabási-Albert model. Second, we want to utilize R and Python as well as Gephi to visually model these networks. And third, we want to predict the next pandemic among vaccinated candidates on a global scale using machine learning algorithms that we are going to integrate into our network. So just a really quick study breakdown, especially what we're going to cover today. There are a couple steps required to achieve our goals in the study. The first is finding an accurate and constantly updating database. There's extreme emphasis on this because we want data that is always accurate and represents the actual populations, or else we could mismodel a network. We also wanted to concatenate our data and clean it up, because often when we find like raw data, especially on pressing matters like COVID online, an issue that we see is that the data isn't often clean or isn't corroborated by other external sources. So we want to do that in the process of exploratory data analysis. Then, utilizing JavaScript, HTML, and CSS, we want to make a simple network of candidates across the globe. Then we want to integrate network science into this model to mock the hubs of infections as well as the vaccines. And this is where, again, the Barabási-Albert model comes into play to model that social network that we find so key. And then finally, the very last step is integrating machine learning algorithms using inputs from data to predict these new cases and breakthroughs. So I'll go ahead and hand it off to Satya, who's going to take you through the progress.
Hey guys, I'm Satya. I'm part of the CovidVacNet team, and I'm going to be taking over for Aniket here. So let's talk about our progress. So this is just a quick preview of our progress. So as you can see on the left, we have a data table of vaccinated percentages for each country. And on the right, you can see we've integrated this into a JavaScript HTML CSS map that will be interactive and allow us to view this data. So let's talk about materials and languages. So we've used a combination of different languages to create our application. So we've used R as well as RStudio. We've used JavaScript, HTML, and CSS to create this interactive map. And so you might be asking, why do we use R for data science instead of Python? Because Python is a very popular language and it's been used in data science very widely. So R offers a statistical analysis while Python is more of a general approach. So R can really get into the data and modify it into an effective form that we can use. We also found R to be a very versatile language that allowed data science operations to go smoothly. So we could integrate R into JavaScript and HTML and CSS much more efficiently. And also using this language, we were able to gather necessary data sets and morph them into a more usable form for us. So let's talk about our data. So our data is perhaps the most crucial part of our project. So where do we source our data? So we consulted existing R packages that were developed by top universities like MIT and Brown, and we also scraped websites such as NY Times and Google. So we utilize these well-known sources to avoid any bias or false data in our applications, because any bias or false data would throw away our results and make them less accurate. And we also had to make sure our data was being regularly updated for prediction. We don't want last year's data, we want this year's data, and we want the most recent data to get the best results. And we assured cross-validation for our data, which is why we consulted multiple sources to make sure our data was valid. So let's talk about our R packages. So with CRN, we were able to find a useful R library, which included a data set that we needed. So for example, this was the vaccine manufacturer data set, and it included data for vaccine percentages that were categorized by manufacturers such as Pfizer, Moderna, J&J, and as you can see, there's an example on the right. So let's talk about website scraping. So we found a couple of good websites. We found Our World in Data, which is a website by CDC. And we also found the NY Times website, which is also verified by CDC. And as you can see, this little graph on the right, which shows you kind of how the data would be modeled if it was plotted across a timeline. And it's for each country worldwide. So yeah. And continuing on our websites, we settled eventually on the NY Times website because it was much more interactive and had a much more clean format to it. It also had live data that was verified. And since it was from NY Times, we could be assured that it was accurate. And as you can see, there's a little snippet of that data table on the right, which you saw in a previous slide. So let's talk about exploratory data analysis. And exploratory data analysis is the term that is used in data science, which talks about how we got our data, we modified it, and how we cleaned it up to better fit our purposes. So we decided to import this data into a couple of spreadsheets. This would make data parsing much easier for a web application and would also make updates to the data much smoother to implement. So spreadsheets were one of our biggest tools in allowing us to implement our data. However, we did run into some challenges. So our data wasn't exactly clean. We had to clean up some of the numbers, and we had to manipulate some of the numbers to make it work for our map specifically. So to do this, we created a formula or algorithm to give us the numbers that we specifically needed. So this is the formula and algorithm development. So we didn't have the vaccinated percentages for the manufacturer spreadsheet. So this is basically talking about what numbers we did have and how we manipulated those numbers to give us what we needed. So starting off with what we were given from our data, we had the total doses of vaccines per manufacturer. So for example, we had the total doses of Pfizer for a country or Moderna for a country. And we also had the population for each country. We had the number of people vaccinated from each country, and we had the total number of doses for every single vaccine, which was categorized by country. So for example, we could talk about the US having maybe 1 billion doses or something like that. So we divided the total number of doses for all vaccines by the number of people vaccinated per country. And this gave us the average number of doses for each person for each country. So for example, to break that down a little bit, if country A had 1,000 doses of vaccine given out and had 500 people vaccinated, then 1,000 divided by 500 would be 2. This means that country A has an average of 2 doses of vaccine per person. Next slide, please. Okay, yeah, so this is our algorithm development continued. So using that average number of doses per person, we could find the number of people vaccinated per manufacturer. So to do this, we divided the total number of doses per vaccine manufacturer by the average number of doses per person. And then we divided this result by the population of the country to give us what we needed, the percentage of people vaccinated categorized by vaccine manufacturer. And to break that jumble of text down a little bit more, let's give you an example. So if country A had 500 doses of Pfizer and 500 doses of Moderna given out, then dividing by the average number of doses per person would give us 500 divided by 2. This means that 250 people were vaccinated by Pfizer and another 250 people were vaccinated by Moderna. And so if country A had a total population of 2,000 people, then 250 divided by 2,000 would give us 0.125. This means that 12.5% of people are vaccinated by Pfizer and another 12.5% of people are vaccinated by Moderna. So this is just an example of what our spreadsheet looks like. This is our manufacturer spreadsheet. And yeah, and this is an example of our total vaccinated percentage spreadsheet categorized by each country. And so let's talk about our coding time. So we modeled our project on a few R libraries to get started. The 2 main libraries we used were tidyverse, which is designed just for data science, and HiCharter, which is a library that allowed us to combine JavaScript and R code with ease to make our map. It also enabled us to get an HTML and CSS linkage going, so it made the entire process really smooth. So yeah, this is the R code right here. As you can see at the top, we have a few libraries, our 2 most important ones being tidyverse and HiCharter. And as you can see, we're reading our Google spreadsheet with that link over there, and we're creating a theme for our HTML website using HiCharter. And then we're importing this data set called world GeoJSON, which allows us to basically take in ISO codes of each country and also an image of a SVG map, which would allow us to combine those 2 into an interactive map that we could see later. And at the bottom, that big wall of text right there is basically just renaming some of the countries to fit that world GeoJSON location dataset. And this right here is our map creation code. And so as you can see, we're plotting the immunizations applied per country using HiCharter. We're adding a series map, which basically is the process of taking those ISO codes and that map SVG image or something and combining those 2 with using this code. And as you can see, we're making a title, a subtitle, and a color axis. And you can see those in a later slide.
Okay, and then taking over really quickly. So on the JavaScript and HTML, as well as the CSS code, we had a couple of prototypes, but initially we made a JavaScript map that included the total vaccination count of each country. And this was done just to visualize the preliminary data that we had created, which was still in the format of CSV files and not yet on a spreadsheet. And to do this, we utilized a Java library, which is called MapIL 2.0 and requires the jQuery library in order to run. This is licensed by MIT and has plenty of SVG maps to choose from to model our data, which kind of made the entire idea of map creation a lot easier. And then we simply parse data directly into the map from our spreadsheet by creating objects for each country and assigning those objects certain values corresponding to populations. So this is some of the HTML code specifically, and this is just where we're creating pretty easy to see containers as well as assigning the values that are parsed straight off our CSV files. And here's a couple of countries right here. Then we have the initial JavaScript map, which is basically a global map, and it doesn't exactly have the kind of legend that we want yet. And another main thing is that not every country had their count on here. So we have a couple of issues that we're going to get into right here. So this map wasn't great, but it had a couple of issues. remember that it isn't able to parse through some of the spreadsheets like we had hoped. At this point, we were using some CSV files and some spreadsheets, which made it difficult, especially because this map had trouble with multiple spreadsheets at a time. Eventually, this map wasn't able to input the percentages we had hoped for, but it did give us a base to work off of, which was really crucial when we came to future maps. And then again, this JavaScript, HTML, and CSS base allowed us to engineer our second map with the help of HighCharter, which just made it way more easy to plug in our values and our variables into JavaScript and HTML. So with the second map, with the power of HighCharter, combining the R code with the JavaScript, HTML, and CSS codes was a breeze. This enabled the data science powers that R had to combine smoothly with the interactive powers that JavaScript, HTML, and CSS had. That just meant that any problems with the data were now fixed, and we can now handle multiple spreadsheets. But in this process, we also cleaned up our spreadsheets, which again just made the process easier. So here's some of the HTML code. Without going into too much detail, it essentially draws in the HighCharter JS code that we were showed on a previous slide. And it also brings in a few modules. And then finally, it creates the website for the map or the web application that we're going to be hosting the map on. Next is a snippet of the Java code, and this part of the code specifically brings in the World Geo JSON data package from HighCharter. JSON is just a specific data format that we chose to use instead of like moving from CSV files back to JSON, which is pretty much engineered for Java. It also integrates a series map, essentially uses ISO codes and a map image or an SVG image to illustrate it. And then finally, it adds some basic map navigation with the scroll wheel function, which was just used for like the UI UX part of our web application. So all of that jumble of code and a lot more code creates an interactive world map. And essentially, when a user will hover over a country, they can see vaccine percentages, but we also created a map for almost every brand of vaccine, simply for the purpose of splitting up our tasks, because later when we wanted to combine all of these, it would just make it a lot more easier when we have them pretty clearly drawn out and with distinct barriers. So for example, the Pfizer map will display percentage of people who are only vaccinated by Pfizer. This does have like one small issue, but I mean, it's not really an issue. The fact that some vaccine or manufacturers don't exactly have every country insured or every country provided, but that's okay because remember, at the end of the day, we're combining all these maps to make a mega map. This just makes it easier. So there's also a map that is not characterized by brand. Instead, it just displays the percent of people who are vaccinated from each country. This is our master map essentially. But again, note that our data is limited. So what we could find in our packages in the internet. So we do not exactly have the numbers for every country, but in the grand scheme of things, the data that we're getting from valid, verified sources is the data that we're going to choose. So even if it doesn't provide everything, it's good enough. So here's our master map, which is all vaccinations. And these are just the percent vaccinated in each country. You see a pretty basic legend at the bottom that describes how like close to 0.0 they are, and then 1. And you see like the different colors for each country, as well as the percent vaccinated. Specifically, when you hover over a country like this, you would see this box pop up. Then we have the map of the world for Pfizer. Note that, again, we don't have the data for every country, but a lot of countries are insured or manufacture Pfizer, which is why we see how much percent of, like the United States, for example, is vaccinated by Pfizer. And it's a great amount, which is 0.6%, almost 60% of the United States. And again, whenever we hover over each country, we see this individual bar pop up with the values that we want. Then we basically did the same thing for Moderna, as well as Johnson & Johnson, Oxford, Sinopharm, and Sinovac. And these are just essentially going through each country. And you'll notice that as we go down the list, you see less and less countries, simply because some of these manufacturers only apply to certain countries that have like restrictions on certain types of vaccines being made. So then,
okay, so I'm going to be taking over this part of the presentation, our future work. So what we have to do that's left. So let's talk about some network science. So this network science field is an academic field that studies, well, you guessed it, networks. And these networks can be computational, biological, mathematical, and telecommunication based. So we use network science to be able to model a series of connected networks through mathematics. And this is so we can better understand the relationships between certain variables and networks to better understand the relationships and connectivity. So for example, in our project, we will use network science to model the connectedness between each country based on vaccination rates in order to better predict the probability of an outbreak. And we're going to be doing this for each brand of vaccine as well. So this is our slide on graph theory. So in our project, we aim to utilize graph theory, and graph theory is basically just a mathematical representation of nodes and edges. And you can see there's a picture on the right, which indicates what a node is and what an edge is. Essentially, a node is like a point and an edge is something that connects 2 points together. And so for example, our project would use graph theory to symbolize each country as a node and each edge as the line that connects 2 countries together. And graph theory also enables us to use weights, which basically allow us to make certain variables matter more than other variables in order to better predict and get more accurate results. So let's also talk about the machine learning aspect of this project. So machine learning refers to a computer's ability to reason about patterns and find connections between variables that might not be apparent to the human mind. So this tool is extremely powerful since it allows the computer to essentially do the work for us in figuring out how certain variables affect and entangle with each other. So in our project, we want to use this machine learning tool to find patterns between the connectedness of each country, which we can get from network science and graph theory, and the vaccination rates of each country by manufacturer. So the purpose of machine learning is to ensure that we can find a pattern between country connectedness and vaccination rates. And that gives us the goal of this project, which is finding the probability of an outbreak. And note that this will, again, be based on vaccine manufacturer. So with machine learning, we aim to figure out how related two countries are together so that when an infection occurs in one country, the algorithm can then estimate the probability that other countries will be infected by the same COVID variant. So to break that down a little bit, we have a little example for you guys. So if Canada, for example, was infected with variant X of COVID, then the machine learning algorithm could predict the probability that the people in the US would also be infected by variant X based on what vaccine they previously used, such as Pfizer or Moderna. So there's a lot of types of machine learning models. And so we have a few examples here. So K-nearest neighbors, or KNN, is basically a model that takes into account a piece of data and tries to find the K nearest or most similar pieces of data to that input in order to reason about what that input represents. We also have linear classification, which is a model that classifies input based on a linear relationship between the explanatory and response variables. And we also have decision trees, which is a series or a tree of questions that the model goes through to try and answer so that the machine learning algorithm can eventually make a decision about the input. And so as you can see, there's an example of a decision tree here. So this decision tree, is for play tennis. And so as you can see, we start with the outlook aspect. And so the machine learning algorithm goes through and answers this question. Is the weather sunny, overcast, or rain? And so if the weather is sunny, it would then go down to the humidity box. And if the humidity was high, then the machine learning algorithm would reason that no, we should not play tennis right now because it's sunny and humid outside, which would make playing tennis not very reasonable. So just a few models continued. We also have neural networks, and this is a really important model because it's basically a series of algorithms that tries to recognize relationships, but it functions similar to how the human brain works. So this model would essentially mimic a human brain and give us similar results to how our human brain finds patterns, except it would be much more powerful since the computer is doing it. And convolutional neural networks, or CNNs, are basically just an add-on for neural networks. And it's basically just a deep learning neural network that's mainly used in image classification. Because CNNs can take into account multiple layers of variables, it's really widely used in image classification, which has a bunch of pixels and colors and etc. So as you can see, here's an example of a CNN, which is on playgroundtensor.com, which should be in our works cited. And so this is just an example of how CNN works. It kind of takes into account a bunch of variables, x1, x2. Maybe you can square the variables. Maybe you can take sines of those variables, cosines, and things like that. And it can also take into account hidden layers and more neurons and weights as well, and can give us accurate results. So finally, let's talk about our application design. So our final piece of future work is to let the map have a fully functional app or website that people can explore to find outbreak possibilities. And so our future work also includes possibly publishing a paper and releasing our ideas to the scientific community to leave an incredible impact. And with the coming weeks, we hope to make a rapid progress on this project so that we can contribute to the community and ASDRP as student researchers.
Okay, so on the closing, we're just going to wrap up and do a couple of questions and answers, but first, we'd like to thank our team. Me and Satya are just a small part of a very amazing team that is in a lot of hard work on this project. We have Medha, Pragya, Roshni, and Ananya as well helping us on this project. And then we'd also like to thank Ms. Jahanikia and ASDRP for supporting us fully, and even when we're slow on progress sometimes, being the extra push we need to get our work done. And if you would like to scan this is just our works cited. If you're interested in any of the topics we talked about today, or any of the concepts, just go ahead and scan that and it'll take you directly to our works cited. I think this is the last slide, so I will go back here and we can start taking questions and answers, and me and Satya will alternate answering questions.
Well done, excellent. You again make me feel proud. That is an amazing, astonishing work. So as you say, guys, there is a lot done, but there is a lot more is left. So it's sometimes not about the coding, but also visualization of the data is most challenging part of this kind of projects, especially when you work on the global scale and your study depends on the current data. So we wish them luck. They're making a huge, impactful work for the society, as the COVID-19 is a hit topic of today's world of research. So I wish them best of luck. Next time we'll come back. We have a lot to share with you guys, right? Yep. Okay, thank you. Thank you, Satya. Thank you, Aniket. Well done, excellent.
Okay, so there's a question in the chat by Joseph Thomas, and I can answer this one. So he's asking if we're planning to include any additional training data. And so we could probably include things like infection rates as well, and maybe stringency index, which is basically how strict a country is with their regulations. And I think including that into our graph theory weights, as well as our machine learning algorithm as neurons or hidden layers, could really bring out more accurate results.
Okay, yeah, and I can answer the next question by Malika Agarwal. She asked, will you also consider other factors like masking policies or other regulations in place in each country when creating the map that predicts the spread of infection across countries? And this is a great question, and the answer is yes, because at the end of the day, these kinds of policies will also contribute to the probability of an outbreak happening. For example, if a country doesn't have a lockdown policy in place versus if a country does, that's going to be a very significant factor. The map creation is just the first step to enable network science, and after that, network science is just one of many inputs that are going to be integrated into machine learning to thus give us that kind of probability.
Okay, so I can answer this next question. So this person's asking which machine learning algorithm would we implement? So we're not sure yet, but I would probably reason we'd go with the CNNs because it allows us to add a lot of different layers and also a lot of different weights, which would bring out more accurate results. And how would it differ from other existing COVID maps? Well, I don't think there's a lot of maps out there right now that categorize based on vaccine manufacturer, such as Pfizer and Moderna. And so giving us that extra edge and giving us something novel to introduce to the scientific community would definitely make it differ from other maps.
Yeah. And then answering the next question, do you think this could be combined with some kind of sentiment analysis of social media to make an even more accurate map? We do think this is a pretty interesting concept, especially because sentiment analysis often reveals like how people are treating the policies that we were just talking about and how people are reacting to it. For example, if they're going out or not, simply because natural language processing can reveal those insights when given those texts. The only thing is that given that our project primarily relies on network science, it would be a little difficult to integrate that sentiment analysis into our project. When we're thinking for the inputs for our machine learning module, we're thinking more like, for example, the policies that we were mentioning, the locations in which infections are occurring, the proximity of current infections to a breakthrough infections, and stuff like that. And while sentiment analysis, again, very interesting idea, it might not reveal exactly what we want, but it also might be non-linear to the inputs that we already have.
Yeah, and I can take the next question by Vineet. So he's asking what role the HTML and JS played in the overall project. So yeah, it definitely helped to visualize the data. The JavaScript definitely allowed us to make an interactive map using SVG vector elements. And the HTML part allowed us to basically create a web application for us to hover over our mouse and play with this interactive map.
Okay, so Megan asked again, looking at the code fails to find other countries. Is there a better data set? Like we mentioned, that code is just a snippet of the overall code we have. But even then, the maps that we're showing, remember that not every vaccine manufacturer is insured in every country, and not every vaccine is deployed in every country, which is why sometimes it looks like the code isn't finding every country. But at the end of the day, every country on the planet has deployed some kind of vaccine, and that vaccine data is available through the New York Times, unless, for example, the country is either authoritarian, so they restrict that data, like for example, North Korea, or the data simply doesn't exist. So for that reason, again, when we combine all these maps, which is the end goal of this visualization, that is to create a very comprehensive data set. Because at the end of the day, the data set is comprehensive, it's just simply split up, which makes the task easier for our end product, which is splitting up prediction based on country and based on vaccine manufacturer.
Okay, so Shravya is asking if we plan on acquiring more data or just focusing on the connections between the data we currently have. And so to that, I'd say, I think we'd be focusing on the connections between the data we have right now, because we want to implement our network science and machine learning to figure out how this project will go forward first. And then if more data does appear, or if we find a better data set that's verified and lively updated, then we definitely plan on using that in our project.
Okay. The next question is from Shravya, or did you answer this one? Oh no, yeah, he did.
Yeah.
The next question is from Joseph, and he asked, how would you use CNNs considering that they're used for images? This is a great question. Again, convolutional neural networks are primarily used for image classification, but the reason that we think that CNNs are like a primarily very good module is because, one, we're using network science, which is already image-based, so that's probably going to help more, especially given the fact that we're going to be analyzing the images in this data set. But beyond that, it also is very good for non-linear modules. That's what Satya mentioned in his slide. And while that is often applied to, like, for example, a lot of pixels on a screen, it can also be very easily applied to when we have a lot of different non-linear policies dictating whether an outbreak occurs, which is why we think that CNNs are the way to go. But again, we're still in the preliminary phases of machine learning, and we're still open to other modules.
So Sharad is asking, does the model just figure out possible percentage of spread only because the vaccine didn't provide protection, like in our Canada example where we talked about variant X? And so, yeah, that's actually the interesting part of this project. It's because we're trying to figure out infections in the vaccinated population itself. And so initially it sounds silly, right? Oh, if you're vaccinated, then doesn't that kind of mean like you're not going to get infected? But when we saw the Delta variant hit and the Omicron variant hit, that kind of ideology was turned on its head, because people who were vaccinated were actually still getting infected. And so this gives us more insight into the variants and how they affect people who are already vaccinated. And also, vaccines don't provide full immunity, they just provide extra protection. So even if you're vaccinated, there's still a little bit of risk that you could be infected. So yeah, that's why our project is a little bit different and more interesting in that regard.
Okay, so Megan asked how would sentiment analysis be present in the project, but I think Madhav answered just a little bit down. So I'm going to answer the next question, which is what factors will influence the weightage of the connections in your ML/graph3 model? Again, a really good question, but some preliminary factors that we're looking at are, for example, the geolocation of where these infections are taking place. That's a big factor on the influence of weightage. Another one is the proximity to other infections when an infection, again, takes place. Next is the vaccine manufacturer that is insuring this individual. And finally, again, like the policies that we mentioned, like masking policies, lockdown policies, and that's pretty much it. Because at the end of the day, we're looking at a combination of these factors, and these factors obviously have many subsets of their own factors that comprise them, but we want to look at exactly what's going to be contributing to someone contracting COVID-19, and especially in a breakthrough scenario, which is often due to increased surrounding of people with COVID-19.
Yeah, so Shashank is asking, oh, sorry, I just asked the question. Okay, yeah, so he's asking, how will variant emergence and spread be incorporated in our ML model? So to that, I think once a variant emerges, or we use historical data on how other variants have affected people for like different vaccine manufacturers such as Pfizer and Moderna. But if a new variant emerges, we have to wait for data on how that affected people of the vaccinated population. And using that data, which is why we chose live updated data, because that would ensure we got the most recent data. And so when a variant emerges, we can use that live updated data to see how it infected people who were vaccinated and how it spread across the country. And that could be used as one of our layers in our CNN or something like another neuron and things like that. And also, yeah, Shashank is one of my friends from kindergarten, so it's great to see that everyone's out here supporting us.
Okay, so next, answering Krishna's question, he says, hey, great presentation, appreciate very much. And then he asked a couple of questions. So first, how did you scrape the data off the websites like the New York Times? This was basically very basic web scraping, but it's also the fact that you can download this data and it's free to access. And we kind of just input it into spreadsheets that update regularly and scrape it directly from the New York Times. But if you want, we can also send you the code for how we scraped it. Another question was, what methods did you use to connect and combine the JavaScript, HTML, and R code? One thing to note with this section, and I'm glad this question was asked, is that these codes are not exactly in the same file. They're in the same folder, but they're very different files. The connection is this, again, library that we use called HiCharter. HiCharter is great because it enables us to combine these different languages, because at the end of the day, languages are just a method for communicating to a compiler. So HiCharter basically breaks that down very, very simply and allows us to connect the different purposes of these languages and uses. For example, we can translate objects that we created in Java to the HTML. And another thing is that we can also translate like the R code and the variables that we created there to the JavaScript. So that's going to help us create the map better. And then lastly, they asked, how did you measure the spread of disease between countries that picked up new diseases and variants? This is a great question. Unfortunately, I can't answer it because we haven't exactly measured that spread yet. Remember that right now we're still in the data visualization phase and we're moving into creating those interactive web applications to model the data. But at this point, we're not exactly measuring spread. We're just more focused on modeling the current data we have in order to construct those networks. Measuring spread and predicting spread is going to come more in our graph theory and machine learning part of our project, which is what we're going to be transitioning into soon.
So Kalpita asked, do you plan on analyzing vaccines which are distributed in other countries, but not the US? So yeah, as you can see, we did say that in our presentation. We used vaccine brands such as Sinovac, Sputnik 5, CanSino, and things like that. So yeah, we do plan to do that.
Okay, so Megan asked, if you're planning on using R for machine learning, what libraries would you use, or do you move to Python? This is a great question. We haven't exactly thought it through yet, but so far we've been using R specifically for data analysis, simply because our task was to, sorry, my camera's getting weird, but our task was to kind of clean up the data and then visualize it in like this format in which we can use network science. Remember that machine learning is the third step in our process. Second is network science. So right now we're preparing for that network science phase, but we would probably see ourselves moving to Python. As we mentioned earlier, we're looking at Python, R, and Gephi to model these networks and then deploy machine learning. And as we mentioned before, with machine learning, you need more of a general approach which is included in Python. But when we're talking simply data science, we chose to go with R simply because it's perfect for data analysis and actually getting to the statistics.
Okay, give me a second. This you see a link in Magana, and I see this one. So many of people are asking. These two individuals are so generous with their time that they're answering each and every question. Again, our study is not to see how many people are vaccinated. We are not mapping the people vaccinated on the global scale because there are hundreds of them. Why their project is different? Because they are mapping the vaccine candidates, connecting the countries that they receive the same vaccinated candidates, using network science to predict based on the percentage that they receive those candidates when the next outbreak is happening. So stop asking what machine learning algorithm you want to use. This is just so redundant. Listen, they said future work. Once they come back with their model, they will let you know why you are not using machine linear algorithm instead of CNN. You're just taking their time. You're asking questions that is their future work. And again, if you did not understand it, request for, I mean, they're so generous with their time. And I'm getting really like frustrated saying all these questions. You either didn't listen or just want to put some question that feel like you have asked questions. So putting that link, that was the first time that when they started their study, they have gone through. And what you're looking in the market, it's not, I'm not defending them. I'm just saying that, or not defending because this is my project. It's just because you are not an active listener. Till the day you're just being there and just randomly listen and question is not helping. You either be an active listener and listen what they have done. They are keep on answering why you are using R or Python. How they know? I don't know even. We keep on changing. I mean, maybe they use Python, maybe they use R. I don't know why you're answering these questions even. Thank you so much. That's going to be a wrap for this questions and answer. No, they're not going to be in attendance till Edward's team will not present. So hang in there.
That was
so thank you so much.
That was a great presentation. So I think now it's hopefully people listen to my presentation, Sahar.
I mean, they said it's a future work, and I'm just like, and I'm frustrated because these two are keep on answering, and I was like, okay. So if it is a future work, how we can talk about it? I mean, so if you just here for the attendance form or just put some question that you have asked a question is a different scenario. But be an active listener if you are interested. So they don't take time because there's other group also waiting. Thank you so much. Thank you guys. Great presentation. Well done.
Okay, great. That was great. I learned a lot too. I'm from a completely different field. Let's see. Is Kira and Maddie here? Are Kira and Maddie here? Okay, so two presenters this evening. Kira Chatwood, senior at Los Altos High School. Maddie Lloyd, who's a rising senior at Notre Dame High School. These two young ladies will be presenting on some of our current work on undergrad. Some of you have heard about before, but we're sharing some new and updated science today from our last undergrad lab presentation several months ago. So without further ado, the stage is theirs.
Okay, this is our presentation on reactivity-informed design, synthesis, and targeted delivery of andrographite and analogs, which are NF-kappa B modulators for cancer treatment and degenerative diseases. Okay, just a quick overview, first of all, of the things that we're going to be going over. First, we're just going to do a quick overview of andrographite and its current progress and basic background information. Then we're going to go into our efforts in RT-qPCR to determine the effects of andrographite on gene expression. Then we'll look at the logic of synthesis. We'll go into top and bottom piece analogs, Michael addition assays, focus on one specific analog known as acetonide, look at Hammett linear free energy relationships, go into substituted benzaldehyde prodrugs, Suzuki cross-coupling, and finish off with antibody drug conjugates, all surrounding andro. So the main focus of our subgroup and what we're going to be talking about today is a small molecule we've been working on called andrographite. And throughout this presentation, we're going to cover how we've tested the biological activity of andro, then harnessed its chemical structure to improve this activity via different analogs, prodrugs, as well as antibody drug conjugates. So our lead compound, andrographite, is a natural product diterpenoid extracted from Andrographis paniculata, which is a plant generally found in South India and Sri Lanka. And as a self-preservation mechanism, Andrographis paniculata tastes bitter to the animals that try to eat it. And andrographite is the main reason behind why the plant is known as the king of bitters. But of course, beyond just being bitter, andrographite is currently also in clinical trials for multiple sclerosis, HIV/AIDS, and has anti-cancer properties. Recent papers have also found that andro exhibits activity in antimicrobial, antidepressant, and anti-inflammatory manners and pathways. And so all around, it's a pretty cool drug that exerts biological activity in many different ways. However, in the context of cancer, andrographite has been found to exert its biological activity through the inhibition of NF-kappa B, which is a transcription factor at the crossroads of a lot of cell signaling pathways, including those around tumor survival and metastasis. And NF-kappa B is a heterodimer of P50 and P65 subunits, as shown by the diagram. Our pharmacophore model consists of two main points. The first is just the AB ring transdeclin system that we believe is important in binding. And the second is the C ring butanylide that is a very good Michael acceptor, which drives its reactivity and its biological actions. And Michael reactions are just used to tag molecules with high selectivity for solvent-exposed thiol groups of proteins, which assays can then be run on to determine binding affinity. And when we first began, we essentially wanted to see the effects of andrographite on NF-kappa B, a transcription factor, because we wanted to understand how andrographite functions in vivo and how it exerts its mechanism of action. So to do so, we did a reverse transcriptase quantitative PCR experiment, also known as RT-qPCR, where we wanted to quantify to what extent NF-kappa B regulated genes are expressed when they're reacted with andrographite. And in order to do this, we treated some Jurkat cells with andrographite, and then we extracted the RNA, and we finally quantified by qPCR. So here's a list of the genes that we looked into that are all related to the NF-kappa B pathway and others related to general cell viability. And these are all the genes that we looked at when we were looking into which genes were affected by andrographite and were amplified specifically by andrographite. And these are the resulting fluorescence curves, which is essentially just a graph of the fluorescence curves from the RT-qPCR runs on leukemia cells. The curves show the DNA being amplified as the experiment was running. Because essentially how RT-qPCR works is that we send in our compound into the cells to amplify the DNA or affect the DNA that it's going to affect. And then the mRNA transcribes it into cDNA. And then the RT-qPCR has this fluorophore called SYBR green that increases intensity as a function of mRNA or cDNA concentration. And we use this fluorescence created by this fluorophore in order to determine or detect changes in DNA amplification, which is then used to determine the mechanism of action in genes of interest based on essentially which genes we know that andrographite affects. And beyond this, we have mainly been, with our previous RT-qPCR experiments, we were looking into mainly the pathway surrounding NF-kappa B. However, a recent paper came out that looked at the effects of andrographite on another pathway known as the mTOR pathway. So because of that, we're going to look into redoing the RT-qPCR with a wider range of genes that are not just coming from the NF-kappa B transcription factor, but also looking at the mTOR pathway as well.
Okay, so andrographite already works well, which brings up the question of why we would want to continue to further modify it. As synthetic chemists, our goal is to take molecules from nature and optimize them for human use. Fun fact, as you can see by this graph over here, natural products comprise only 3.8% of the compounds that are used in clinic, whereas molecules that are derived from natural products comprise 19%, with over 5 times the number of natural products themselves. Plants don't care about curing cancer, but we do. This is why we chose to make analogs of andrographite, better versions of natural products that could potentially be more potent, less toxic, and more effective. So there's a couple of specific goals in developing natural product analogs. The first is improving potency. As demonstrated here, 33 analogs of chrysomycin A were made, one of which had 5 times the potency of chrysomycin A itself. This is important because we can take natural products that are not that potent otherwise and make them useful. This is especially important in the context of things such as antibiotic drug resistance. Another goal we have is an altered mechanism of action. Some prodrugs can exert effects on a different pathway in terms of biological activity or a different mechanism of action. As you can see on the slide, aureomycins are a class of antibiotics with weak activity and a limited spectrum. An analog of aureomycin A, G0775, was made, and it was determined to work through a different mechanism of action against various types of bacteria. Another goal with synthesis can just be improving physical properties. including manipulation of the rate of hydrolysis and enhancing stability. As you can see here, this analog was made for more rapid DNA cleavage. So here's an overview of the different goals you can hope to accomplish with synthetic chemistry. Throughout this project, we're specifically focusing on biosynthetic engineering different andrographite analogs, but also working on semisynthesis. Okay, so here's an overview of some of the synthesis of some bottom and top piece analogs. When we refer to top piece analogs, we're talking about substitutions on the C ring, if you remember from the model that Kira showed us before. When we refer to bottom piece analogs, we're talking about substitutions on the A or B rings. So over here, this is andrographite. If you take andrographite and treat it with 2,2-dimethoxypropane and PPTS, which is a weak Lewis acid, you'll make this analog called acetonide. We can diversify the acetonide into a number of C-ring analogs, including installation with C14 acetate with neat acetic anhydride, and treating that with base eliminates from 1415 to give this diene product here. This is the acetate, this is 1415. And then taking either acetonide or andrographite itself and treating with DBU and N-phenyl triflate, we get this other diene product down here. This has all been previously assayed. We're also working on synthesizing this analog of andrographite through the Evans-Sequenza reduction reaction. We plan to flip the stereochemistry of C3. The main question here is, how does one chemically invert a single stereocenter? We plan to do this through the Evans-Sequenza reduction, which is a stereoselective reduction of beta-hydroxy ketones to the corresponding anti-D alcohols. This is a 6-member transition state that the reaction is believed to go through. So this is the Evans-Sequenza reduction, where the intermolecular hydride delivery from the boron-reducing agent forces the reduction to proceed from the opposite face of the chelating beta alcohol, thus determining the diester stereoselectivity. So as previously mentioned, andrographite exerts its biological activity through the inhibition of NF-kappa B, a transcription factor. It does this through alkylating cysteine 62, an amino acid in the NF-kappa B P50 subunit. It utilizes its C-ring butanylate, a good Michael acceptor, and Michael additions to form a covalent adduct. Michael additions are the nucleophilic addition of a carbanion or another nucleophile to an alpha-beta unsaturated carbonyl compound containing an electron withdrawing group. So after the synthesis of all these previously mentioned analogs, Michael addition assays were used to measure the Michael acceptor properties of andrographite as well as its analogs. The reaction above shows a Michael addition reaction where we use 5-thio-nitrobenzoic acid as a quantifier of the Michael acceptor properties of andrographite. We want our compounds to be good Michael acceptors for a few reasons. First is that Michael acceptor properties alkylate NF-kappa B to drive biological activity. Second is that NF-kappa B has a nucleophilic cysteine that is a binding locus. And thirdly, because it forms a covalent carbon sulfide bond with the protein. So here are the results of our Michael addition assays. Our compounds outperformed andrographite 10-fold in the first 5 minutes, demonstrating the power of synthesis. Consistent with expectations, andrographite, which is compound 1, and acetonide, which is compound 2, performed equally well as Michael acceptors. Compound 4, which is the 1415 elimination product, demonstrated similar Michael acceptor abilities as andrographite, indicating that the elimination of the hydroxyl group as C14 doesn't affect Michael acceptor capabilities. Compound 5, which is the 1112 elimination product, proved to be a significantly better Michael acceptor. Compound 3, with an acetate in place of a hydroxyl at C14, demonstrated the poorest Michael acceptor kinetics compared to the other analogs. After these studies, we wanted to focus on one compound that we were particularly interested in: acetonide. Acetonide is simply a ketol with 2 methyl groups. So we installed this acetonide to andrographite with 2,2-dimethoxypropane, PPTS, which is a mild Lewis acid, and acetone. This gets on average a yield of about 90%. So the reason why we're specifically interested in acetonide is because it's got better biophysical properties for cellular uptake. It's more bioavailable, calculated on the basis of what we call a C log P, or partition coefficient, which is a non-numeric function of the compound's hydrophobicity and therefore its bioavailability. In comparison to andrographite, acetonide is more bioavailable and more hydrophobic. So we hypothesize that this compound is going to get into the cells more quickly, because bioavailability means that the compound is more compound is able to be absorbed, and if something is more hydrophobic, it is better able to cross cell membranes. In previous literature, it has been said that acetonide is several times more potent than the natural product andrographite itself, which could be causing the inhibition of the growth of cancer cells. Because acetonide was determined to be more potent than the natural product itself, we wanted to determine the reason for the difference in potency. Essentially, we wanted to know if the compound structure itself is better, or that the compound delivers more andrographite into the cell by being more bioavailable. So essentially, whether acetonide was a prodrug or an analog of andrographite. A prodrug is a masked version of the drug that is not potent by itself, but later becomes a drug in biological systems. An analog is a different version of a small molecule drug that simply works better by virtue of that structure. So in order to determine whether acetonide was a prodrug or an analog, we ran a number of hydrolysis experiments. Hydrolysis is the chemical breakdown of a compound due to reactions with acid or even water. We found that even under slightly acidic conditions, as you can see here between pHs 6 and 7, the acetonide begins to fall off. Within 4 to 5 hours, we see complete hydrolysis of the acetonide back into the natural product. Based on these results, we have great confidence that acetonide is a prodrug. Oops, sorry. Okay. Then to get quantitative results after a qualitative experiment done by TLC, we used HPLC, or high-performance liquid chromatography, to determine the exact hydrolysis rate of acetonide, or the role of the positive acid catalyst. HPLC usage is used to map retention times of andrographite, an anti-cancer natural product, and its many analogs, so as to determine the ability of the drug to be activated via cleavage from an antibody conjugate. Essentially, the reaction that this quantitative usage of HPLC monitors is a cleavage of acetonide into andrographite. This research workflow serves to validate how stable acetonide is by assessing its ability to cleave off into andrographite. In turn, these results will be used as a benchmark when synthesizing other analogs of andrographite of a greater stability than acetonide. Seen on this slide is some preliminary data from HPLC that we've been getting along with our collaborators in the Yamamoto and Chen groups. Essentially, we're using HPLC to quantifiably measure the concentration and separation of acetonide and andrographite over time.
Based on this data, which indicates the acid cleavage and decomposition of the andrographite acetonide as its mechanism of action, we were inspired by the Hammett-free linear energy relationships. And these relationships essentially hypothesize that there is a relationship between the aryl substitution or any substitution, or which is essentially what group we put onto the 4 position of the benzaldehyde, and the willingness of the benzaldehyde to give up an electron to form the hydroxyl group. Since this is the rate determining step in the hydrolysis of andrographite, we hypothesize that if we can control the pKa of the benzaldehyde on the andrographite compound, we could theoretically control the rate at which it hydrolyzes in contact with acidic environments, such as the lysosomes and cells, which is where we believe that the andrographite will be internalized into once they enter the cells. And as noted by this table, here we go. Different aryl substitutions have different pKa's independently, which means that they each have a different willingness to donate an electron. For example, while a nitro group has a much lower pKa, meaning it's much less willing to donate an electron, a methoxy group has a much higher pKa and is much more willing to donate an electron. And as this schema illustrates, when an aryl substitution is more electron donating, the anionic charge is less stable because via the mechanism in arrows on the benzaldehyde here, the electron that gets donated serves to generate more anionic charge, making the molecule more willing to give up the hydrogen and start hydrolysis. On the other hand, less electron donating substitutions create greater anionic stability, thus decreasing the rate of hydrolysis. And something else important to note here as well is that this applies not just to the 4 substitutions, but also to the other substitutions on the benzaldehydes, for example, the 3 substitution. However, 3 substitutions are generally less willing to donate electrons than the 4 substitutions because the 4 substitutions are just in the right position for the electrons to flow naturally in terms of how they're being donated, whereas the 3 position is just more inhibited in terms of electron donation, which means that the 3 versions of all of these compounds are less electron donating than all of them individually. So in order to exert complete and quantitative control over the rate of hydrolysis, because we wanted to be able to control completely how fast the molecule will cleave in the cell, because this is really important in order for us to be able to determine, I guess, payload and concentration over time of our drugs, we worked on developing these substituted benzaldehyde prodrugs. And through developing different aryl and alkyl substitutions off the benzaldehydes that would then be conjugated to andrographite, we hope to be able to quantitatively measure their effects of hydrolysis through HPLC and then determine if we can control the rate at which the prodrug hydrolyzes and releases andrographite. Since we hypothesized that andrographite analogs get hydrolyzed in acidic environments of lysosomes, we believe that controlling the rate of hydrolysis could ensure that we maximize binding in vivo, because we would then be able to control essentially the concentration and the uptake of the cells in vivo. Something important to note about these is that we found that they were extremely acid sensitive, because after we had synthesized essentially all of these prodrugs, we had worked them up or extracted them in brine in order to eliminate dioxane, which is a solvent, because it won't rotovap or evaporate off because its boiling point is just too high, which meant that we had to extract them and we used brine, which was a mistake because we essentially hypothesized that there were some trace acids in there, and because this hydrolyzes even under extremely weak acid conditions or even under water conditions, the use of brine without a base in there in order to neutralize any acidic environments meant that all of these had essentially hydrolyzed by the time that we wanted to use them, which was not very helpful. So now we're going to extract them in a basic environment by using sodium bicarbonate in order to avoid the problems with them hydrolyzing. However, this probably is good because it means that our compounds will hydrolyze effectively and shows that our rate of hydrolysis studies will probably proceed effectively. Another thing that we're working on within our group right now is a Suzuki reaction. So this is known as a Suzuki cross-coupling, and we're just essentially trying to bind these molecules together in order to couple them to andro. So this reaction here shows the 4-bromobenzaldehyde diethylacetal being coupled to the 3-amino phenylboronic acid along with palladium acetate, a ligand, and there should also be K-carbon there as well as dioxane. And this is then transformed into a Suzuki product, which as you can see is the biphenyl product with the 2 phenyl rings there and the amine product on the left. So we've been condition screening the Suzuki cross-coupling in order to determine how effective it is at generating the product that we want to see from the reaction. And we've tested multiple different starting materials or starting boronic acids, as well as a variety of different ligands. So the first thing we tested was simply the phenylboronic acid, because we want to ensure that the Suzuki reaction would proceed properly, which it did for all of the ones in which the LCMS. We confirmed all of these reactions by LCMS, which is a type of mass spectrometry, which is able to identify your product based on mass. And we saw our correct product mass, so we identified product in all of these examples for all of the ligands, except for one where the LCMS was unclear, but we just need to rerun that. I think it was just a problem with that run rather than whether we're seeing product in the first place. But after that, we wanted to run it with the aminophenylboronic acid, because in terms of the Suzuki reaction is competing with a different reaction, which is known as a Buchwald-Hartwig reaction. And the Buchwald-Hartwig reaction is an amidation, which means that it essentially binds the amine group. As you can see here, it's the bottom one on the right, which leaves the boronic acid exposed, whereas we would prefer the Suzuki reaction because we want to run a separate amidation coupling afterwards off of the amine group that we wouldn't be able to if we had the Buchwald-Hartwig proceed, because then the amine group disappears, but because it gets coupled with the bromine. So we're looking at this, and fortunately we were able to isolate Suzuki product out of all of these. However, we were thinking that it would be interesting to look into a method study, specifically comparing the the relative reaction rates, I suppose, of the Suzuki and the Buchwald-Hartwig reactions, because they are competing reactions. And it would be interesting to look at whether things such as solvents or whether things such as ligands would affect the rate or at which these reactions progress or which ones naturally progress. So we initially hypothesized that the Suzuki reaction would just be more likely to progress in our current set of conditions, because first of all, the amine is just a less good Lewis acid, which means that it's less willing to attack the electrophile bromine, which means that the reaction is less likely to progress in terms of the Buchwald-Hartwig versus the Suzuki. But second of all, butch weld Hartwigs are generally performed in anhydrous environments because they don't want any acidic interference, generally because it's a less strong Lewis acid, so it needs a stronger Lewis base conditions and more basic conditions in order to ensure that there's no acidic interference with the reaction. And furthermore, we believe that the butch weld Hartwig reaction needs a specific type of ligand because it needs generally bidentate ligands with large bite angles, because the rate determining step in a butch weld Hartwig is the reductive elimination, and that is forced by these bidentate ligands, which essentially attach in two regions to the palladium, which is the catalyst, and force this reductive elimination, which otherwise is much less likely to occur. And absent this bidentate ligand, it's a lot more inefficient in order to go through the butch weld Hartwig versus the Suzuki. So we hypothesized that all of these conditions were generally pushing towards having a Suzuki reaction if we don't do anything to interfere, but we thought it'd be interesting to see whether we could force a butch weld Hartwig or whether we could see whether having different ligands would create different relative ratios of Suzuki to butch weld Hartwig in terms of our product. So that's just another thing we're doing. And finally, another thing our group is working on is the development of ADCs, or antibody drug conjugates, which is essentially an antibody that works as a messenger system, a drug payload, and then a linker that connects the two. We're working on developing 2 generations of a scalable linker that can selectively deliver andrographite to cancer cells, because while andrographite is pretty potent, by concentrating all of the payload to cancer cells via attaching it to an antibody, we can ensure that all of our compound goes exactly where we want it to, which means that we ensure that we have maximum potency and selectivity for these cancer cells and have the drug work as best as possible while having to insert as least of it as possible as necessary in order to achieve the same effects. So we're currently working on developing a linker, which is a big part of our subgroup right now. However, since this is information we are hoping to patent and have an NDA with our collaborators, we unfortunately cannot reveal much more than that, but it is another very exciting project we have in the works right now. And just to wrap up with our future plans, there's a couple of things that we still really need to get done. First of all is these benzaldehyde substitutions. We just need to get them out of the way. All of them have been set up. So we're looking to finish those off and then run HPLC hydrolysis analysis on all of those reactions in order to determine the rate of hydrolysis and compare that to andrographite and acetonide and each other to see whether we can control the rate of hydrolysis and whether our Hammett relationship holds true. And the second thing we're looking at is, of course, the Suzuki method study to see whether that can pull through. And finally, probably the majority of our efforts in this subgroup right now are devoted towards the linker, which we're really hoping to get out by the end of the summer. So yeah, that is our presentation and our efforts so far. Thank you so much to the new group, to our collaborators, NanoAnalysis, Sunny Bay Biotech, which are main collaborators, and of course, our team. And of course, thank you to Edward, the lab techs, Anu, Natasha, Shrishti, Rosie, Samyukta, Harrison, and the entire andrographite subgroup for everything you've done. Okay, any questions?
Kira, that was a very good presentation. Very good. Any questions? No one dares challenge the demonstration. That's crazy. People have questions? Somebody looks forward to our progress. That's great. I look forward to our progress too. Okay, so if there's no other questions, don't forget the attendance form. Kira, Maddie, you two did an awesome job. That was really good. And we'll see you all next edition of Colloquia.